Hello and welcome. Diabetes Prevention Week is taking place from the 26th of May to the 31st of May 2025. To raise awareness about diabetes and the importance of managing this condition, we have created this short video to explore the question of can we prevent type 2 diabetes? My name is Rory Rooney and I work as one of the dietitians in the NHS Diabetes Prevention Programme. The first question to answer is, what is diabetes? And put simply, diabetes is having higher than normal levels of sugar, also known as glucose, in your bloodstream. And it's this excess of sugar that can lead to serious complications, including sight loss, kidney disease, cardiovascular disease, in other words, heart attack and stroke. Even sexual dysfunction and nerve damage have been linked to higher blood glucose levels. The next question is, do we need glucose? And the answer is yes, we do. We need glucose to live. It's glucose that gives energy to every organ and tissue in the body, allowing it to function properly. Your brain requires glucose to think and make decisions, your heart to pump blood all over the body. Your skeletal muscles need it for movement like gardening and cooking. Glucose comes from the food you eat, namely carbohydrates, also known as carbs. When you eat carbs, your glucose goes up and back down. It returns to this level your body considers just right. The hormone insulin is responsible for making sure that glucose is removed from the blood and stored in your cells, where it can get used for energy. So it can be helpful to think of insulin as a key that unlocks these cell doors inside us, allowing glucose safe passage out of the bloodstream. Problems can happen if these doors are not properly maintained, if you like. In other words, you get rust, the locks get rigid, and the key might stop working properly. And as a result, the door does not open. And if the door does not open, glucose starts to accumulate in the bloodstream, which increases your risk of developing type 2 diabetes. The amount of sugar in your blood slowly gets higher and higher until eventually you develop some of the early symptoms of type 2 diabetes, such as using the bathroom more frequently or experiencing extreme thirst or tiredness. The level of glucose in your blood can be measured with a hemoglobin A1C test. A level less than 42 is considered normal and healthy. Greater than 47 is what's considered as type 2 diabetes, and a level between 42 and 47 is what's called pre-diabetes. When cells stop responding to insulin, in other words, you get rusty locks, it is called insulin resistance. To prevent progression to diabetes, we must focus on those lifestyle changes that are protective against insulin resistance. Studies consistently show a link between weight loss and lower risk of diabetes, especially when combined with a reduced waist size. People who lose just 5% of their starting body weight have significantly lower HbA1c levels. Perhaps one of the best things we can do for our body is move it, however you like to, be it gardening, lifting weights, cycling or dancing. They all help to increase your metabolism and maintain muscle tone, two things that contribute to nice, stable glucose control. Aim for at least 30 minutes of movement per day and don't sit for too long. Stand up is regularly and stretch or do a task, release of or just walk around from the food you eat, helping to suppress large glucose spikes and protect against diabetes. My advice is to cook and prepare more food at home and include ingredients that are high in fibre, including fruit and vegetables, beans and pulses such as chickpeas and red split lentils, or having nuts and seeds with your breakfast or as a snack. Choosing whole grain foods is another way to boost your fibre intake. For example, you might switch to wholemeal bread or brown rice or brown pasta, and choose other whole grains such as oats and pearl barley. Consider reducing your intake of foods high in both fat and sugar. These tend to be heavily processed foods that a lot of us find irresistible. These foods release glucose very quickly, which in turn damages our cells and makes it harder for insulin to do its job properly. You don't have to avoid these foods. You only have to think about how much you currently have and to consider cutting back by having smaller portions or having these foods less frequently. Both of which I have seen resulting in profound benefits for the individual, both in terms of their physical and mental health. Support is also available through the NHS, who provide a diabetes prevention programme and weight management lifestyle programmes. Please get in touch by scanning the QR code or simply calling us on 01563 55 4574. Thank you.